My name is Alexandra Tutwiler, and today's date is January 1st, 2022. Here is the paper with the bolded outline terms that I will be using for this presentation. So to start, disease definition. It's an illness or condition that causes dysfunction to at least one body system. It can be short-lasting or long-term, and a person can either obtain this throughout their lifetime, or an individual may be born with a certain condition. So an example of a disease is hand, foot, and mouth disease. Next, disease classification. So a disease is classified by the body system that it causes physiologic dysfunction to, or by its pathology or etiology, or the causative agent of the disease. So an example of this is strep throat. Its etiological agent is streptococcus, and this bacterium causes dysfunction to the throat. Etiology is what causes the disease to occur. So an example of this is that a virus causes influenza. Pathogenesis describes the beginning and the development or progress of a disease. So an example of this is that coronary artery disease begins by the development of the inflammatory process in a fatty streak that then goes to the occlusive vessel lesion. So symptoms are subjective clinical manifestations that cannot be measured by an observer. So an example of this is a headache, whereas signs are objective clinical manifestations that can be measured by an observer or seen. So an example of this is elevated temperature that is measured by a physician using a thermometer. Syndrome are all of the signs and symptoms that are used to describe a specific disease state. An example of this is chronic fatigue syndrome. A diagnosis is the actual condition or disease that a patient is experiencing at a given time. So an example of this is bacterial pneumonia. Complications are adverse reactions or outcomes that a patient has a possibility of developing after treatment or during a disease, or during the timeline of the disease. So an example of this is that pneumonia is a common complication of AIDS. A prognosis means that a physician is able to make a prediction of what is going to happen in the future. So an example of this is a patient that is diagnosed with stage 4 lung cancer might get the prognosis that they are only expected to live about 6 months after the original diagnosis. And last but not least, diagnostic tests are used to help confirm the condition or disease that a patient has. So we use laboratory tests and different blood work in order to help confirm that a patient has that specific disease.